So, cinema therapy, as with all therapy, when we are practicing psychotherapy, we have to also be ethical. We take our ethics hopefully quite seriously so that we don't do harm to the patients that we treat. And similarly with cinema therapy, we have to be just as cognizant regarding the ethics that go behind recommending film and being thoughtful regarding how we're prescribing what we're asking our patients to watch. Interestingly enough, my patients, I never prescribe them films, weirdly enough, because they prescribe me things to watch all the time. So I'm watching films and episodics for hours to keep up with their life. But it does really help me to be able to say, let me think about it ethically regarding what I may ask you to watch. I need to think about whether or not they are ready to really be able to watch some of these films even. Some of them can be quite triggering or just overly stimulating for them in many ways. More importantly, I'm really thinking about the ethics regarding cultural factors as well. Escort, Vanical, like many individual theorists talk about how in cinema in particular, we can prescribe, let's say, my Asian patients a film to watch, and they are Chinese, and yet within this film, they're Korean, and I'd like them to be able to associate to some individuals who don't really relate to them. So I need to also be thoughtful, who are these actors? What is this story really being told? And will it really match with their cultural background? Similarly with religion even, within our last film in particular, it's what is your religious beliefs? Your parent goes to the better place, your parent is in heaven. That may not work for your patient. So being sure and sensitive that you're being thoughtful regarding what their values are is really important when we're prescribing films to also be a part of their lives. I say a good film will stay with you a lifetime. And so if we're really thinking that is the case, then I'd like it to actually be able to be something that can imprint on who they are and who they like to become and who they want to be in their life in the future.
And I would like to add to that, because there's also a piece where when you're working with clients, that sometimes you do have to assess if they're ready, right? So if you have a film that you think does very nicely match, it doesn't always mean that as you track the person through their therapeutic healing, that they're ready to confront that thing. And you'll notice it in a little thing called resistance. You'll notice it when they start to maybe put down some suggestion, or when they become irritable. Sometimes it could be behaviorally, when they stop coming, come late, cancel at the last minute. So there's these pieces where they're giving you a message that they may not be ready. So it's important to really be aware that if you are prescribing films, that you are making sure that they're at the right place to then start addressing the concerns that you're trying to match. And with that, I would say, and I think it's obvious, but I'll say it, make sure you watch the film. Please, you might have heard of it, you might have read about it, someone might have told you that it's a perfect fit,